Crowds are back on the streets of the world's second most populous country. India's government is easing restrictions on offices, markets and public transport. Hotels and restaurants aren't allowed to open for another week, but people lined up for street food. Opinion on the lifting of these measures remains divided though. More activity is good news for India's hundreds of millions of daily wage earners.
We're worried about coronavirus. It's a disease, but we have to eat as well. If we don't have an income, how can we eat? How can we feed our children?
While others disagree, despite being out, taking advantage of the easing restrictions.
As you can see here, lots of people are here, and it's not good because social distancing is must. So I don't think it's good.
With nearly 200,000 cases, India climbed to the 7th spot on the list of countries worst hit by the coronavirus. Officials here in Delhi have decided to close their borders for a week as the number of cases in the capital region continues to rise.
The disease is still increasing, and we are getting more and more people who are in numbers, and the severity of disease, because this being a tertiary care hospital, we are getting people with mild severity, and we are not seeing where is the end.
Without an end to the pandemic in sight, states say they are continuing to improve their healthcare facilities.
Your Chief Minister is assuring you that if there is coronavirus in your home, don't worry, we have a bed for you. We have made the arrangements.
Despite the rising number of cases, India has one of the lowest mortality rates at 3%. And while less than a quarter of all deaths in the country are medically certified, experts say a higher death toll from the virus wouldn't go unnoticed. India still doesn't have enough data on coronavirus cases and deaths, but it does on the economic impact of the lockdown. 114 million Indians have lost their jobs, 90 million of whom are daily wage earners. And both the government and health experts say a blanket lockdown must be lifted in areas with fewer cases, and Indians must learn to live with the guidelines on social distancing and hygiene. Elizabeth Puranam, Al Jazeera, New Delhi.